Welcome back to the Hip Replacement Podcast. I'm Chris Bystriansky, your host. I'm also a two-time hip replacement patient. I'm about 10 years out. I'm at least 10 years out from my last hip replacement surgery and almost 12 years out from the one before that. So 2 hip replacements and over the last 10-ish plus years. And since then, I've done Ironman triathlons. I've done other endurance events. I've been through aches and pains. I've kind of learned a lot, and I'm here to share these lessons and tips with you. And in this episode, I'm going to talk about how I knew I was going to be okay. Because honestly, for the longest time before the surgery and for months around the surgery time and after the surgery, that I was pretty pessimistic on the outcome. I was absolutely terrified of the surgery. I was terrified of what life would be like after surgery. And just as background, my wife and I were my wife was about to give birth to our first child, and I had a surgery, 2 months before our daughter was born. And my whole goal for the surgery was just to be able to help my wife and be able to play on the floor with my daughter. So I had very low goals, and playing on the floor with my daughter, certainly a worthy goal, and helping my wife is certainly a worthy goal. But being able to walk or to run or to go and live the lifestyle that I wanted to, it really wasn't in the cards for me in my mind yet. But there was a specific point where all of those things came back on the table. And I'll tell you about that in this episode. It was very, very important because it really changed the trajectory of my recovery and the things I wanted to do later in life, later with my new fantastic hips. I went through a lot of physical therapy, and it was a lot of work listening to the physical therapists and just going through different tests and protocols that they had. And honestly, it was painful. Going into the clinic and doing the exercises, the stretches, and doing weights. And I really felt that a lot of times they were pushing me a little too much, but I trusted them. I trusted their process. And, months of the physical therapy in the clinic, and then also physical therapy at home. And I was trying to, number one, live a normal life, and really wanting to get rid of a limp I had because I was pretty embarrassed about the whole situation, and I wanted to get rid of the evidence of the hip replacement surgery. And the biggest piece of evidence was the limp that I had. So going through the physical therapy was really my way of doing everything that I possibly could to eliminate the limp and get back to a basic normal life so that I could play on the floor with my daughter and help my wife out around the house. And at the time of the surgery, we were living in this neighborhood, and it was a loop, and it was about three quarters of a mile around the loop with a lake in the middle. It was sort of more of a retention pond, but everyone called it a lake. But in my mind, if you look at it on a map and it does not have a name, it's not a lake, okay? It's more of a retention pond, which is what it was, but it was very nice. And it was about 20 feet below the level of the houses with a nice grass embankment. So it looked like a lake. It was beautiful. And there were houses around the road on the inside, so along the lake, and then houses on the outside, so across the street from the lake. So it was pretty nice. It was about 3/4 of a mile walk around. And before my surgery, I was really struggling to get around that lake even one time because of the pain. And I wouldn't even really try that much. But it was a big shock for me, because a big change in lifestyle for me, because in the 10, 20 years before my surgery, I would walk around a golf, which would be about 6 or 7 miles a couple times a week generally. And I would go walk, I would go run. I was very active. So for me not to be able to walk even 3/4 of a mile around that lake in my neighborhood was very challenging for me to accept that, man, I was so limited in my mobility that I could not even do that. So after the surgery and after some physical therapy, after a couple of months of the physical therapy, it was still painful to walk a little bit. And I was on mobility help or limited mobility, meaning I was on 2 crutches. Well, after surgery, I was on a walker for 2 weeks, and then 2 more weeks on 2 crutches, and then 2 more weeks on 1 crutch. So we're talking 6 weeks out, I'm still using something to help me be mobile. Well, after the 6 weeks, I started to walk around or hobble around without any aids. And this was at the direction of the physical therapist and the surgeon, who were very involved in the recovery. But I really wanted to be able to walk around that lake. And it took me about 3 or 4 months, 5 months, the courage to try to walk around a lake. Because even walking around the house or walking in my office for my job was a challenge. It was kind of painful, but I knew I would have to get up and walk some distance. And the thing about walking around the lake, it was a lot of walking at the same time without a break. You know, I could walk around my office or walk around my house and sit down in the kitchen or at my desk or any number of places, and it wouldn't be an extended amount of walking at the same time. And that's really what I was concerned about, because it ached. I would get, at first I tried not even going halfway around, because I would obviously have to walk back, and that would be the same amount. But I would go, let's say 10 houses down and then come back. And I would be in pain. I would have to stretch. I would have to ice my hip. My muscles were sore. The joint just didn't feel great. But after about 4 or 5 months, I walked around. And I remember getting home and, just talking to my wife about how I was able to make it all the way around. And she was so happy and pleased. And I was happy and pleased, and just a little bit of soreness. I stretched, I iced it. But I was able to go around, and I did it a couple more times, a couple more days. Weeks go by. I'm trying to walk around the lake one time, and then that is when it dawned on me that, I think everything is going to be okay. By about month 5 after surgery, and I know some people go a lot faster than this. I repost, I talk to people, and they're running half marathons 5 months out. Well, okay, but I simply wasn't comfortable with that, because I was in it for the long game. And I wanted to get strong, not have a limp, and really be careful, because I wanted to be the best father and husband and athlete and person I could be later on without a limp, without doing anything to damage my hip, and just live a normal life. And me being able to walk around that lake really helped me to get more comfortable and more confident in my ability to be strong, to be flexible, to have mobility. I was in my 30s when I had that first hip replacement, and I was really worried about not being mobile for the rest of my life. That was a real fear for me. But walking around that lake that first time gave me the light bulb or the confidence to keep walking around that lake every day. And after several weeks of doing that, going around twice. And honestly, I was sore. I was sore each time I did it. But that was so important to my progress. You know, I was not in a rush. I kind of took my time. A quarter mile, three quarters of a mile would take me, I don't know, 15, 20 minutes, maybe 20 minutes, maybe more, because I was just being gentle. And that's a pretty slow pace, but I hadn't been able to walk that far in a year. You know, the 5 months after surgery and many, many months, maybe even a year, 2 years before the surgery. So I was pleased with just going that distance and having that repetitive motion on the hip. So it was very rewarding for me. And that was when I knew that, yeah, I could push this a little bit more. I'm going to keep getting stronger. I'm going to keep doing the physical therapy at home. And I know I'm going to be okay. And it was then that my original goals of just being able to play with my kids on the floor or take them for little walks or helping my wife around the house really expanded and blew up. And those goals were simply not sufficient anymore because I knew I could do a lot more. And I knew at that point that, you know, I wanted to get back to golfing, walking those 6 or 7 miles. I didn't know how long it would take. I didn't know if I'd be able to ride my bike again the way I want to ride my bike, you know, and do 50, 100-mile rides. But that gave me hope in that, yeah, I could see some significant progress, and I reached a milestone in my recovery, so to speak. So what does this all mean? You know, if you're going through a recovery, look for little pieces of evidence where you're getting better, where you're reaching a goal, where you're having a light bulb go off, and that, wow, I can really get better. I can be better than I was before. I can be better than I have been in years. If you're having any doubts or concerns, look for those things. Maybe it's you're able to stretch a certain way or walk a certain distance or do something you have not been able to do before. And just noticing that big advancement, that big goal in your mind, just achieving that and realizing that that's happened may give you the courage, like it gave to me, and the confidence to really think bigger, to think more that, you know, I'm going to be okay. And not only am I going to be okay, I'm going to get back to where I was before. And it wasn't until years later where I had other aspirations of doing Ironman triathlons and all these things. But getting around that lake was the shock to my system that I needed, that really changed my trajectory. So when you're going through your recovery, look for little areas of improvement that give you hope and give you some confidence that you could really return to everything you wanted to do, and realize that magical moment is happening for you, and it's really going to set the tone for your long-term success. So I hope this was helpful to you and helps you have a better recovery and helps you realize that you're going to be able to do great things. And maybe that light bulb or that spark doesn't happen at 5 months out for you. Maybe it happens at 1 month or 2 months or 1 year or 2 years or whatever it is. Just notice that at some point you're going to hit something, you're going to do something, you're going to achieve something that will help you realize that, wow, you're capable of a lot more and you can get back to whatever you want to be doing. So I hope that's helpful to you. I hope that's helpful to you for our tune into the next episode because I'm going to bring on my wife to talk about her experiences going through this. I mean, we can talk about ourselves as hip patients and what we were going through, but a lot of us have spouses or family members or friends that are helping us, and it's great to get their perspective. When I came out of surgery, I asked my wife what she did, while I was out, and she gave me an answer, but we never really had a discussion about what was going through her mind in the months leading up to surgery, what was going through her mind while I was in surgery, in the months after when I was going through all the recovery. She was 7 months pregnant when I had my first surgery, so I know there was a lot of things going through her head, and we never really had a deep, full discussion on that, and we're going to get into that in the next episode because these other people in our lives are very important to our success, and they should be supported just the way they support us going through the surgeries and the recovery. So keep an eye out for that episode. And I look forward to a great discussion with my wife and sharing that with you. So thanks so much for tuning into the Hip Replacement Podcast. And until next time, I wish you the best recovery possible. Take care.